More than 50 cases of suspected Zika in the Bahamas, all showing up negative. Good evening, Bahamas. I'm Altaviz Munnings.
I'm Keisha Adderley. Thanks so much for joining us tonight. Topping the news, health officials are closely monitoring the Zika threat as the mosquitoes carrying that virus are said to be in the Bahamas. This as health teams in the United States are investigating 2 cases which may have been contracted right in Florida.
Well, during a press conference this morning, health authorities say they are stepping up mosquito control efforts in wake of the threat. Carla Palmer leads us off tonight.
According to the Pan American Health Organization's report dated July 7, 2016, 40 countries and territories have cases of the vector-borne transmitted Zika virus disease. During a press conference today, local health officials confirmed that the Bahamas is included in this number, along with 9 other Caribbean countries. Chief Medical Officer at the Ministry of Health, Dr. Glenn Benaby, says testing of suspected cases began in January this year.
As of July 9, 2016, there have been 56 cases of suspected Zika virus, all of whom have had samples sent to the reference laboratory for testing. To date, all results received are negative for Zika virus, and we are grateful. We continue to monitor especially the relationship to pregnancy and the detection of any abnormalities related to pregnancy. During pregnancy, and a congenital abnormality in the babies called microcephaly, an abnormally small head with underdeveloped brain.
The Zika virus is transmitted primarily by the bite of an infected Aedes aegypti mosquito, the same mosquito that reportedly transmits dengue, chikungunya, and yellow fever viruses. These mosquitoes are commonly found around homes and breed in standing water sources.
The mosquito is a day biter with increased biting activities 2 hours after sunrise and several hours before sunset. Other modes of transmission have been identified, including passing the Zika infection from mother to baby and sexual transmission from infected partners. Cases of blood transfusion and laboratory worker infection have also been documented.
Symptoms most common to the Zika virus include fever, headache, muscle and or joint pains, skin rash, and conjunctivitis or red eyes. The symptoms reportedly begin 2 to 7 days after infection, and only 1 out of 5 persons will develop symptoms. The disease is usually mild and lasts 2 to 7 days, and there is no specific treatment or vaccine currently available.
Few people die from this condition. There's no real treatment. Recently, they have had a few deaths, one recently in Utah in the United States. It's the first such death. But we appreciate the state and the outcome of these conditions determined by the state the person is in when they're exposed and all the other factors involved.
Health officials say heightened surveillance is continuing with the relevant agencies like the Department of Environmental Health. Assistant Director there, Andrew Thompson, says his department is aggressively fogging, especially in those areas of suspected cases.
Mainly around suspected cases, and the idea is to try to do fogging around that case a number of times, a quarter-mile radius. And the idea is to try to if there are any infected mosquitoes, to knock the infected mosquitoes down. And so we're doing that on an island-wide basis.
Of those 56 suspected cases, officials confirm several tourists to have been among the number.
If you are planning to travel, please become informed regarding the country you plan to visit. For travelers returning to the Bahamas from a Zika-affected area, even if you do not feel sick, you should take steps to prevent mosquito bites for 3 weeks after returning to decrease the likelihood of spreading Zika.
Health officials say the most essential control of the Zika virus rests with individuals. They advise that you wear long-sleeve, bright-colored clothing, turn down all standing water, use repellent, and repair household screens. Carla Palmer, ZNS Network News.